Hello everyone! Today, we will be presenting our project titled Improving Access to Mental Health Resources for University Students in Malaysia. This study focuses on understanding the barriers students face when seeking mental health support and proposing actionable solutions for improvement. Let's dive into the details. Mental health challenges are prevalent among university students, particularly in Malaysia, where studies reveal rising rates of anxiety and mood disorders. Despite the increasing awareness, a significant portion of students do not seek professional help due to stigma, lack of awareness, and inadequate institutional support. Our project aims to bridge this gap by investigating these issues and developing recommendations for various stakeholders. We identified three key barriers. First is lack of awareness. Only 21% of students surveyed by previous study demonstrated adequate knowledge of mental health issues. Second, stigma. The cultural and societal norms often label those seeking help as weak, deterring students. Third, institutional limitations. Limited resources, long waiting times, and insufficient operating hours restrict access to support. These issues result in decreased academic performance, social isolation, and heightened mental health risks. Our research was guided by three questions. Conflict theory. How do financial and social inequalities impact access? Structural functionalism. What role do mental health systems play in students' well-being? Labeling theory. How does stigma affect help-seeking behavior? These sociological frameworks helped us analyze the systemic, institutional, and cultural factors affecting mental health access. We identified four actors. First, university management, responsible for policy creation and resource allocation. Second, students, both the beneficiaries and active participants in utilizing resources. Third, student unions, advocates for students' needs and organizers of awareness campaigns. Lastly, the government provides funding, regulatory frameworks, and national-level policies. Each actor has a unique role in overcoming barriers to mental health access. Therefore, the objectives of our study are: first, assess barriers, understand stigma, lack of awareness, and institutional challenges. Second, evaluate institutions, measure the effectiveness of university mental health systems. Lastly, propose recommendations, offer strategies for key actors to improve access.
To investigate these issues comprehensively, we used a mixed methods approach. First, surveys. We distributed structured questionnaires to collect quantitative data from 30 university students. These surveys focused on barriers, institutional support, and stigma-related factors. Second, interviews. We conducted semi-structured interviews with 3 students to gain qualitative insights into their personal experiences and perceptions of mental health resources. This combination of methods allowed us to gather both broad statistical trends and deep contextual insights. However, we acknowledge some limitations, such as the potential bias in self-reported data and limited generalizability due to convenience sampling. We also have done literature review to analyze previous studies. College years are a critical period for development, where students face challenges such as financial issues, academic pressures, and lifestyle changes, all linked to mental health problems. Research by Kessler shows that most mental disorders emerge before the age of 24, highlighting the urgency of addressing mental health during this stage. Additionally, several factors shape student attitudes toward mental health. Cultural and religious backgrounds, personal experiences, and environmental triggers, such as childhood adversity, further exacerbate these challenges. Stigma remains a key barrier, especially in Malaysia, where family stigma limits access to resources. Globally, mental illness is often seen as a weakness, with studies like one from Qatar reporting that 34% feel ashamed to disclose their struggles. This stigma prevents help-seeking behavior, worsening the impact on students' mental well-being.
This study applied 3 sociological theories to understand mental health accessibility for university students in Malaysia. Structural functionalism highlights how systems like education and government policies support students. Failures in these systems, such as stigma or misaligned resources, disrupt the balance and hinder access to care. Conflict theory focuses on inequalities. Students from rural or low-income backgrounds face greater barriers due to unequal distribution of resources. Collaborative efforts and inclusive policies are essential to dismantle these inequities. Labeling theory examines the impact of stigma. Negative labels discourage help-seeking and lead to isolation. Awareness campaigns and supportive campus cultures can normalize mental health discussions and reduce stigma. These theories guide our understanding and solutions for improving mental health access in universities.
First, let's talk about the survey result, the barriers of accessing mental health resources. We observed that 56.7% of respondents identified financial constraints as a key barrier to accessing mental health services, indicating a general consensus that there is unequal access to mental health resources based on socioeconomic status. When talking about university priority focus, most respondents believe that universities place more emphasis on academic performance rather than mental health support. Additionally, the most significant obstacle we identified through the survey is lack of awareness, is the most commonly identified obstacle, followed closely by financial costs and limited availability of services. Now, let's talk about the effectiveness and role of universities on mental health services. Majority of respondents agree that mental health services play an important role in the overall functioning of their university and think that their university mental health services are in fulfilling their role to support students. However, from the data, the majority of the respondents rarely participate in mental health promotion activities. This is aligned with the result from the previous study done by Maher, which is showing that only 21% of students have good knowledge on mental health issue, as not much students often participating in awareness campaigns. Hence, most of the respondents think that the university should improve on the counseling services and awareness campaigns to support student mental health better. This indicates the need for more inclusive and engaging initiatives to attract students to participate in the mental health awareness and improve the quality of the campaigns. The final section of the survey addresses the issue of stigma surrounding mental health. A significant number of respondents expressed hesitancy in seeking mental health services due to concerns about being judged or labeled. Many felt that speaking openly about their mental health challenges could lead to being treated differently. When asked about the impact of being labeled with a mental health condition, the majority agreed that it negatively affects both academic performance and social interactions. Additionally, responses to the effectiveness of mental health initiatives were mixed, with most participants rating them as either neutral, ineffective, or only somewhat effective. This suggests a lack of consensus on the success of these initiatives in addressing the stigma and supporting students. Let's now explore the insights gathered from the interviews. These semi-structured interviews were conducted with 3 university students in Malaysia. When discussing the barriers to accessing mental health services, participants highlighted that, despite the availability of on-campus resources, the additional costs of off-campus clinics were a significant challenge. As one participant shared, for families with financial difficulties, these costs can be a barrier to student access to mental health support. This financial strain creates a barrier, particularly for low-income students who struggle to cover the costs of off-campus care. Furthermore, international students face their own set of challenges. Cultural and language differences, combined with a lack of familiarity with the available mental health resources, make it even harder for them to access support. These factors contribute to additional layers of difficulty for international students seeking help. When it comes to the effectiveness of mental health services, one participant emphasized the importance of accessible support, stating that accessible support reduces dropout rates and helps students cope with stress, anxiety, and academic pressure. This highlights the critical role that mental health services play in both academic performance and emotional well-being, allowing students to better manage the demands of university life. However, many students pointed out challenges such as insufficient staff and long wait times, which can deter them from seeking help. Another issue was the limited operating hours of mental health services, which often do not align with the busy schedules of students. This creates another obstacle to accessing the help they need. Hence, students suggested expanding operating hours to make services more accessible and hiring culturally competent counselors who are equipped to understand and address the unique needs of a diverse student population. Finally, stigma remains a substantial barrier when it comes to seeking mental health support. Students expressed a deep fear of being labeled as weak or unstable, which often prevents them from reaching out for help. High-achieving students, in particular, were reluctant to seek support due to concerns about being judged or seen as less capable. To combat this stigma, students proposed a few solutions. One key recommendation was to ensure confidentiality and anonymity in counseling services to make students feel safer in seeking help. Additionally, they suggested launching awareness campaigns, such as "It's okay to not be okay," to reduce the stigma and encourage open conversations about mental health. Therefore, our study analyzed collected data to uncover key challenges in accessing mental health resources among Malaysian university students. First, let's talk about the key barriers to accessing mental health resources. One of the major barriers identified was economic constraints. Students from rural or low-income universities were especially impacted, as these institutions often suffer from funding shortages, limiting their ability to provide adequate professional mental health support. International students also faced unique challenges, language barriers, and lack of familiarity with local healthcare system. From a conflict theory perspective, these findings highlight systemic inequalities. Power imbalances in resource distribution exacerbate barriers for marginalized groups, such as low-income and international students. Unequal funding and institutional disparities create an uneven playing field, leaving already disadvantaged populations with fewer opportunities for support. To address these challenges, we propose several key recommendations targeting universities and government institutions. For universities, we recommend increasing funding for mental health resources, particularly in underserved areas. Subsidized or free counseling should be provided for low-income students to ensure financial barriers do not prevent access to care. Universities should also invest in cultural competency training for mental health professionals, ensuring that international and marginalized students feel understood and supported. For the government, we emphasize the need for equitable funding across all universities, especially those serving rural or low-income populations. Policies should mandate that basic mental health services be provided in every higher education institution. This would help create a standardized baseline for mental health support nationwide. Mental health services are crucial to students' academic success and overall well-being. However, there are notable gaps in effectiveness. From a structural functionalism perspective, mental health services are vital for maintaining academic and emotional stability. They play a stabilizing role in the educational system. When these services are inefficient, such as through inadequate staffing or limited accessibility, the university's ability to fulfill its role as a stabilizing institution is weakened. To address these gaps, we propose actions for key stakeholders. Universities should hire additional counselors to reduce wait times and extend service hours. Staff should also undergo cultural competency training to ensure inclusivity for international students. Student unions can advocate for greater inclusivity and establish platforms for students to provide feedback. Students themselves should increase participation in mental health programs, as they can help improve and normalize the use of these services. Finally, the government should implement standardized guidelines to ensure consistent quality and accessibility of mental health resources across all universities. Stigma remains a significant barrier to addressing mental health challenges among university students. Our findings reveal its profound impact. From the perspective of labeling theory, stigma acts as a social label that reinforces negative stereotypes. When students internalize these labels, they may view themselves as weak or incapable, leading to lower self-esteem, isolation, and a reluctance to seek help. This creates a domino effect, where labeling by society exacerbates mental health challenges instead of resolving them. Breaking this cycle requires collaboration at multiple levels. The university management should launch anti-stigma campaigns like "It's okay to not be okay" to normalize seeking help. Student unions should establish peer support groups that create safe, judgment-free spaces for students to share experiences. Students should actively challenge stigma by fostering a supportive campus culture, advocating for open discussions, and encouraging peers to access resources. The government should promote mental health as a strength, challenging cultural perceptions, and reframing mental health care as a form of empowerment in national-level campaigns. Thanks for your watching.